Hello, I'm Leslie Smart, President of CHI St. Joseph Health Foundations. And on behalf of our leadership, physicians, and employees, welcome and thank you for supporting Evening of Hope. This event brings together for the first time the 5 CHI St. Joseph Health Foundations, united in raising support for a very important cause, cancer care resources, in the communities we serve in Bardstown, Mount Sterling, Lexington, Berea, London, and Corbin. This year alone, Kentucky is estimated to have over 30,000 new cases of cancer and more than 10,000 cancer deaths, which is the highest rate of cancer deaths in the country. At CHI St. Joseph Health, we are pioneering next-level cancer care to combat this disease. For more than 40 years, we have led the way in cancer treatment and diagnosis throughout Central and Eastern Kentucky and support over 73,000 patient visits annually. As we continue to deliver highly specialized care, expertise, and convenience, we've expanded our access to second opinions and breakthrough treatments through our affiliation with the Cleveland Clinic Cancer Center, rated the nation's top program. We are fighting and innovating to deliver the best outcomes for Kentuckians, but we need your help. You have the opportunity to make a real difference to fight cancer through philanthropy. In the spirit of our founders, the Sisters of Charity of Nazareth, these critical dollars will allow us to continue to help every person, regardless of their ability to pay for cancer care. And we will bring hope to our friends, family, and neighbors as they battle this disease. Mother Teresa once said, "Hope sees the invisible, feels the intangible, and achieves the impossible." Join us and invest in our mission to save lives. In just a moment, you will hear an incredible grateful patient story and the importance of philanthropy that directly impacts the quality of care we are able to provide. But first, I'd like to extend our gratitude to our generous sponsors who made this event possible. I would also like to thank our hosts who have created a special event experience for you. Both our sponsors and hosts care deeply about this mission, and we are so appreciative of their role. I also invite you to support our silent auction, which you will find through the One Cause link on your phone. Generous businesses and individuals from across our state and beyond have donated one-of-a-kind packages. You will also have an opportunity to provide an outright gift of support for our cancer needs. Your host will provide more details following the video presentation. Thank you again for your commitment to bring hope to our cancer patients. And now let's learn more about the amazing care provided to a very grateful patient family.
Well, in 2014, I had a mole removed from my arm, and it was melanoma, and I had it removed, and the margins were fine, so I just never thought another thing about it. And then in 2016, I started feeling sluggish and just had a lot of aches and pains, especially in my back. And I just attributed to my age and to my weight, and I just didn't listen to my body. And I finally just went in for an annual physical, and through blood tests and an ultrasound, it was discovered I had cancer. I didn't know the type of cancer, I didn't know the extent of the cancer, but I did know I had cancer. I had all the tests and scans and biopsies done, I think within days of when I was discovered I had cancer. And then when we were in the examination room waiting for the results and waiting for Dr. Crowley to come in, we were just so quiet. We couldn't even talk to each other. I know we were both just silently praying for a miracle. And then Dr. Crowley came in, and she let me know that I had stage 4 metastatic melanoma, that it had invaded my internal organs, my lymph nodes, my spine, and it was just an out-of-body experience. I just remember like looking at the situation and seeing Gary crying, and I know I was probably crying. I just don't remember, but I just heard words: metastatic, terminal, inoperable. I remember thinking, this is what it feels like to be told you're dying. You know, this is it. This is what everybody dreads.
Just complete shock and grief and fear that I may lose my precious wife of 35 years, and what the impact would be on our child. It was unbelievable. I couldn't think.
But Dr. Crowley just went into action, and she connected us with a clinical trial at Vanderbilt, and we went there.
She coordinated it, got it all together.
Yeah, she was amazing. And we went there and checked it out, but when we came back, I had a complication and ended up back in the emergency room where I had another CAT scan done, and it was discovered that my cancer was just growing at such an alarming rate. I really didn't have time to wait for the clinical trial, so we decided to be treated here at St. Joseph Health. She knew exactly what breakthrough drugs I could get on, and that afternoon I was on the immunotherapy Opdivo and Yervoy, along with radiation, and it just worked on me. It just worked. It gave me some serious side effects, but within 3 treatments, it was gone. It was just amazing. It was a miracle, truly a miracle.
Every aspect of Barbara's care has just been amazing. When she was diagnosed, she was quite symptomatic with liver lesions, bone lesions, soft tissue lesions, a recurrence of her melanoma. At that time, immune therapy was really new, and we decided to attack her tumor pretty aggressively with a double combination of immune therapy agents. And she received 2 to 3 rounds of that treatment before, unfortunately, having some fairly significant toxicities in terms of side effects. But after stopping treatment, we were able to help her recover from those side effects. And despite having a very heavy disease burden in 2016, she is now disease-free and has been off therapy for 4 years now, which is just amazing to see. One of the really nice aspects is that we're able to intervene on patients' behalf and get second opinions with content experts at Cleveland Clinic for challenging cases or atypical cases when we need that additional input. The physician here presents to the board at Cleveland Clinic the imaging, all the pathology from the patient, as well as the patient's progress and their history. And then Cleveland Clinic gives us a complete treatment plan as if the patient were being treated at Cleveland Clinic that we can then share with the patient and deliver here locally.
I just know that cancer doesn't care how much money you have in your bank account, and through donations, when people can get financial assistance in that way, it's, it lets you concentrate on yourself to get better, knowing that something is going to be alleviated, some kind of pain will be alleviated.
And we saw that. There are families and patients that obtain financial assistance from the St. Joseph Foundation, so that they could get their medications or treatments or transportation that they otherwise couldn't do. I mean, it's just so important because everyone is just so scared and they're in shock.
Four years ago, when I thought I was going to die, I never thought that I would see my son, my only child, marry just a wonderful woman. And they're happily married, and they have a little they have a daughter. I have a granddaughter. And I'm just enjoying spoiling her and enjoying life with Gary. And it's nothing short of a miracle. And, to God goes all the glory. But he sure did use Dr. Crowley.
And the whole team.
And the whole team. Everybody.
The staff.
Yes. I owe them so much. It was just, if you can say it was a wonderful experience, it might be a stretch. But if you had to go through it, I wouldn't have wanted to gone through it anywhere else.
Absolutely. Absolutely.
It is incredibly meaningful, and really it's why we do what we do. Cases like Barb's, I'm able to give patients hope. When other patients present with stage 4 disease, there is always that window of hope, especially now with newer technologies like immune therapy and targeted therapy. We're able to give patients that glimmer of hope, and sometimes that's all they need.